I'm the school health liaison for the rural and tribal communities for the Youth and Schools team here at Pima County. Let's get started with the agenda. So this month's agenda is going to be as follows. We have our announcements. Next presenter will be presenting from the EPI division, measles, what school staff need to know. Then we have a presenter from maternal child health, responsible teen driver, and then we're going to end today's presentation with teen pregnancy prevention program. I'd like to advise everybody, if they have questions, can you please hold them till the end of the presentation, and we'll get to them as promptly as we can. All right, so the next slide, we'll be going up to our announcements. No additional announcements, but this is going to be our announcement for subscribing to our monthly newsletter. This is going to be having announcements, resources, and more information. You can click on the link there and you can sign up, and we'll send you that information in your inbox. All right, we have our presenters ready for the next slide here. I believe we have Anissa Taylor and Crystal Rambeau is going to help us out on this one.
Hello. Hi.
Hey, Anissa.
Okay.
I'll switch over.
Okay. So first talk about measles, the signs and symptoms. For those of you who are not aware, I know we've been talking a lot about measles in the media right now, but just to go over some things, because there's a lot of high fever, rash illnesses, but measles fever is going to be really high. And you're going to start with something called a prodrome. So it's before the measles rash, you're going to see that high fever. So this isn't a low-grade fever. It's going to be spiking really high, even sometimes up to like 104 even. You're going to see the typical 3 C's. So that's cough, coryza, which is a lot of runny nose, and conjunctivitis, the 2 red eyes, red watery eyes. Sometimes you might see something called Koplik spots, which are small white spots in the mouth. It'll start after the initial prodrome of the high fever and the 3 C's, but before the rash. Then after that, then you'll start to have the red blotchy rash. It can be even kind of lacy appearing, and that's going to usually be 3 to 5 days after those first initial symptoms. Some complications, and this is for progressed disease and for those who tend to be more immune compromised, that can be pneumonia, encephalitis, and of course, as you know, we've even had the death in Texas, for instance. Next slide, please. These are just some photos. These are classic CDC photos that we've probably all seen and also in the media. The Koplik spots here are kind of hard to tell, but they're kind of on to the side in the roof of the mouth. You might be able to get some better, images online, but I was trying to use, verified images, of course, that are CDC verified. But as you can see here, obviously in different skin tones, the rash might look a little bit differently. But of course, it's going to be a blanching rash. So when you press down on it, it's going to look white. It might be a little bit raised over, but it tends to be a flat rash. It's not typically going to be itchy. It's not going to be a vesicular rash like blisters, like pimples, like a herpes type rash, or like a chicken pox type of rash. Next slide, please. Measles transmission. So it is highly contagious. So this isn't something that's going to just fall down in the air. This will sit in the air. It's a small virus, meaning those droplets from coughing, sneezing, talking, singing. You're probably going to be too sick to sing, but they're going to stay in the air. They can stay in the air for up to 2 hours after you leave. So it's highly contagious. One infected individual can infect 9 to 18 non-immune people. So that's why vaccine is so important. Having your immunity is really important because it can spread so quickly. It can, again, remain in the air after people have, been there for 2 hours later. So 9 out of 10 unvaccinated people are susceptible to getting this. So that means those infants who are too young to be vaccinated, those who have been through chemotherapy, who no longer have an immune system, or who are on immunosuppressed medications, those people are obviously most at risk. And pregnant women, who have not been vaccinated, they are most at risk. Next, please. Again, as you know, we're having 3 outbreaks right now across the country. This was last updated last week. I looked today, the CDC still has the same information. We know we're getting current information from ProMed. That is a site that you can subscribe to. Each of the states are kind of reporting their own numbers, but I wanted to be consistent and just leave it as stated for the kind of national outbreak that we have going on. So we have an outbreak in Texas, New Mexico. We do have a case in California, and we also have a small outbreak in New Jersey as well, but we do have cases in 9 different jurisdictions overall. So again, as of last week, we had 164 cases. That's quite a bit of cases. That's, pretty unprecedented in this time where essentially prior to this, we were having cases, but at one point in the US, measles was essentially, contained and non-existent. So this is a big deal. So vaccines are very important right now. Next slide, please. And I will let Crystal take over.
Thanks, Anissa. My name is Crystal Rambo. I'm the Immunization Program Manager. So I was going to talk to you all about some immunization-related topics in regards to measles, and then a couple other things, and then I'm going to hand it back over to Anissa for one final slide. So looking at the measles vaccination rate, so this is for MMR, the measles, mumps, and rubella vaccination. So you'll see in the little circle here, it says that we need 95% coverage to prevent measles transmission in a community. So just sort of keep that in mind. That's a benchmark. We're always aiming for 100%, of course, but we also know that there's going to be some people who are unable to receive the vaccine. So 95% is kind of really what we're aiming for. So for worldwide coverage, we're at about 83%. Of course, that's an estimate. For the United States overall, 92.7% of kindergartners have received 2 doses. And for Arizona, 88% of kindergartners have received 2 doses. So we are below that national average. And you can see also a pretty good amount below that 95% benchmark. Next slide. So the next couple slides really look more at our Pima County coverage, so you can get more information at the local level. This chart here shows you the red line is 6th grade, then you have green is childcare, and then blue is kindergarten. So you can see that the rates overall have been dipping over time. We had a very slight increase from 22 to 23 in the kinder set, and a couple other ups and downs, but generally these have been trending lower, unfortunately. So we are seeing lower amounts of coverage with the MMR vaccine. And you can also see on the side there where that 95% threshold is. So something to keep in mind that even though some of these changes are very incremental, as we approach that 95%, it gets more and more concerning. Next slide. And then this one shows you by school type. So you have red is charter, and then you have childcare in blue. Private is that yellow color. Purple is public, and then total is the black dashed line. So we can definitely see some trends among different types of schools and the kind of coverage rates we're seeing. So this is something to bear in mind depending on what type of school you're working with or that you're at, that you may be seeing different types of populations at these schools, and it's important to keep in mind that you may see different coverage levels going along with that as well. Next slide. This slide's pretty dense, but basically this is a really high-level snapshot of the recommendations. So for children, of course, we're going to be looking at 2 doses of MMR. We typically give the first one around 12 to 15 months, and the second one between 4 to 6 years of age. Just keep in mind that it's never too late. If a kiddo gets behind, they don't need to restart or anything like that. We can always get them caught up. It's not a reason to not come back in. No concerns there. If you were born before 1957, it's generally considered that you were exposed or naturally immune. If you're a healthcare worker, that's not going to be the case. You'll still need to be vaccinated. If you were born between 1968 and 1989, it's likely you received at least a single dose in your childhood, and are most likely you don't need to get another one. Again, though, if you're a healthcare worker, you'll need a second one. If you're born after 1990, you probably got 2 doses, and you probably got them as a routine pediatric vaccine. Another note here is that pregnant individuals should not get the MMR vaccine because it is live. However, pregnant women, once they deliver the baby, can be vaccinated to make sure that they're protected. And another important note here, during an outbreak, vaccine recommendations may very slightly change. So just keep that in mind, that those recommendations may be a little bit altered during outbreaks to make sure we're doing the best we can to reduce transmission. Next slide. The good news is MMR is widely available generally. It's at commercial pharmacies. Pediatricians generally carry it very, very frequently. Our own clinics have it. If you have students who are uninsured or underinsured, we can immunize them at any of our clinics. And we have a link there with clinic information that includes hours, locations, things like that. Next slide. These are some prevention strategies. If you have hesitant parents, you can have one-on-one conversations and look at their concerns and try to address them. Reviewing all your vaccination records for compliance. Sometimes we wonder if some of the numbers that we're seeing for certain immunization rates for certain schools, it could be a result of just not being able to look at those records carefully. So it's always good to make sure that your records are reviewed at your school. If you have a PTO or a PTA that you can work with for advocacy or education for parents, they can be a really good kind of way to interact with your parents in a very trusted environment. If you have any opportunity to do incentives for vaccinations, you can look at something like that, and sending out reminders for compliance for students who may need to still be vaccinated. So one important note, I know not all these strategies are going to work for every school. They're not always going to be appropriate for every school population, but these are just some ideas to consider that might work for your own school population. Next slide. Some prevention strategies. We, of course, know that, as Anissa talked about, for how this is transmitted, hand washing isn't going to do everything, and measles is not the best one for that, but it's always a good one to be promoting your kids to doing hand washing, and encouraging students and staff to stay home when sick. That's always a good recommendation if we're dealing with any kind of transmissible disease like this. Next slide. And then some preparation strategies. If you have an opportunity to work on a measles action plan for your school, and there's some things there that you can include, like what are some things you could do to increase your immunization rates and thus your protection? What would be your rapid communication notification plans? Do you have a way to isolate anybody if they are at risk for having possible measles? Do you have a way to rapidly identify which of your students would be most at risk, or which students are not vaccinated? Do you have cleaning and disinfection protocols? All of these would be good things to think about prior to having any kind of case in the community. If you have an opportunity to prepare pre-written communication templates, like emails, letters, social media posts, those are really nice things to have before anything happens, so that you're not trying to go through those types of things that can be really slow and tedious when you're actually dealing with an outbreak situation. I see Michael's hand up. I don't know if you want to answer that now, John.
Yeah, Crystal, I'll jump in. So hi, everyone. My name is Michael Webb. I'm the program manager for youth and school communities. And thank you, Crystal, for presenting, and Anissa, and for everyone on the call. As far as pre-written communication templates, I am pleased to share with you that we are in the process of approving a template that will go out to all school partners in Pima County. And so just be on the lookout for that. We're happy to assist in providing that toolkit to you.
Awesome. Thanks, Michael. Yeah, those are really nice things to have, because they are just so much harder to make when you're in that moment and you're trying to work on things like that. It's very challenging. Next slide. This might be my last one. Yeah, so I will hand this back over to Anissa for how to manage a suspected case.
Thank you. Actually, and I wanted to kind of tag that back to Michael really quickly. Michael, does that include other languages? Because I know that's been something that I've been working with TUSD on, as well as, different languages when we have that.
Yeah, that's a great question. So right now we're in the process of approving the language for the template that will be disseminated in English, but I'll bring this to the table with the senior leadership team in terms of how we can expand access in a multilingual fashion.
That would be great. I think that would be wonderful and very proactive for us. So thank you, Michael.
Thank
And
you.
now we'll move forward with this. So if you do have a suspected case, obviously as school nurses and health officials, we want you to isolate and mask and call us in epidemiology immediately. So that's going to be 724-7797. We have someone answering all the time. I know you have certain hours, but we don't. We're on 24/7. After hours business, we have an epi answering all the time. So please call that number and let us know, and we will help give you recommendations. We want to make sure that that child is evaluated and tested appropriately, vaccine records reviewed, if they are unimmunized, all of that information, medical history, symptoms, any kind of travel history, were they in a place where there's an ongoing outbreak, that kind of information, that's really helpful. The specimens that we do prefer are urine and NP swab. Blood can be collected, but it's not the best. And then, of course, if there's anyone else there at the time, do they have siblings there? Are they having symptoms? Infant, brother, sister, any kind of, information is helpful. And then, of course, for people, we would recommend to clean and disinfect the room. So if it's in a hospital situation, if it's a waiting room or something like that, we would want that closed for 2 hours. And that's what we tell all of our healthcare workers. And so we'd want the same in kind of a setting where there's going to be possibly people who are going into the same room who also lack immunity. Because again, someone going in there can be exposed for up to 2 hours. So we want that area kind of closed off. Next, please. Any questions?
All right. Thank you again, Anissa and Crystal and Michael, for that information on measles. Again, we can hold some questions at the end of the update. I'm actually going to move on to the next presenter. We have Sam Cha, health educator from MCH.
Hi there, everyone. My name is Sam Cha. I'm a health educator with the Maternal Child Health Program, and one of our programs is the Responsible Teen Drivers Program. Today, I'm going to tell you a little bit of overview about our program, what we do. I'm going to include some of the sample slides from the presentation. It's going to be a very shortened version of what I usually do. I present to local high schools, family resource centers, any place where teens and parents of teens will be, and so we can do that, and so we'll give you a little overview, and also how you guys, how you all can help promote our messages as well. So some statistics, things that we always talk about with teen drivers, they do have one of the lower rates of seatbelt use of all the age groups. So 43% of high school students do admit that they don't always wear their seatbelts in the last 30 days. Motor vehicle injuries are one of the leading causes of motor vehicle crashes are one of the leading causes of injuries and deaths among teenagers as well. And so a couple of things that we talk about: seatbelt usage. And then next slide, please. Other things that we talk about is paying attention to the road. So that includes not texting and driving. We also mentioned that, staying off your phones in general, especially for teenagers, because they are just starting to drive. So they're still kind of in the learning stages. It takes a little while to build up your driving skills, so that so we recommend keep the distractions at a minimum, not texting and driving, and also to keep you cognitively attuned and your attention on the road. Make sure that you're not, never drive under the influence of drugs or alcohol. Next slide, please. And so this is an interesting study that they did, was with the teenagers. They surveyed teenagers about their driving habits and also of the driving habits of their parents that they've observed. So as you can see, one interesting thing is 78% of teenagers have admit to that they've been texting while driving. But on the other side, teens also say that about 59% of them say that they've seen their parents texting and driving as well. So another thing is about a third of teenagers admit that they don't always wear a seatbelt while driving, and then about 47% say that they've seen their parents driving without their seatbelt as well. So we also remind parents as well that try to be a good role model for your teenage drivers, because if they see you texting and driving, they see you driving without your seatbelt, they'll think, oh, it's okay, my mom does it, my dad does it, it's okay if I do that. So try to be a good role model for the teenagers. Next slide. So we'll talk a little bit about graduate driver's licensing here. Here in Arizona, we do have graduated driver's license. So the learner stage is the first stage. 15 and a half is the minimum age to get that, where you get your learner's permit. Once you do, you turn 16, you are eligible to get an intermediate driver's license. What that means is during the first 6 months, you have your intermediate driver's license, and you do have certain restrictions. So between midnight to 5 a.m., you're not supposed to be driving on the road unless you're coming home from, like, say, a job or a school sanctioned event. And also during the first 6 months, no more than one passenger under the age of 18. That's put in place because the more teenage passengers you have in your vehicle, the more distractions that there are in the vehicle as well. There are some exceptions for, family members, things like that. Next slide, please. So we're talking about the three types of distractions here. We have some we have some LOL, IDK, I don't know. Some of the things that teenagers use when they're texting. But VMC is visual, manual, and cognitive. So visual includes taking your eyes off the road. Manual distractions are anything that where involves your hands, taking your hands off the steering wheel. And then cognitive distractions are where it's taking your mind and focus off driving. Next slide. And so one of the statistics that we cite at about 55 miles per hour, sending or reading a text, which usually takes about 5 seconds or so. They're using this for the example. It's like driving the length of a football field with your eyes closed. So that's a long distance to not be looking at the road. People don't realize, like when they're driving, how much distance they cover and all the things that could happen if your focus isn't on the road, if it's on your phone or something like that. Next slide. So the three types of driving, again, visual, that can include like applying makeup, texting on your phone, trying to scroll through, finding your contacts. Manual includes maybe eating, doing your makeup, reaching for items, or if you, like trying to get coffee or something. And then cognitive is anything that takes your mind off the road. So again, you're focused on your phone, or we also ask teenagers also make sure you're in good emotional state when you're driving. So you're not upset about something, you're not in a very angry mode, or you're not in a very where you're emotional, crying or something like that. You want to be in a very stable emotional state when you're driving so that you can focus on the road. And one thing that you can see across all of these visual, manual, and cognitive distractions is your cell phone. Texting and driving, even just talking on your cell phone, it covers all three of those because your eyes aren't on the road, your hands aren't on the steering wheel, and your mind is not focused on driving. Next slide. So here at the health department, we do work with our communications team to post, to do Facebook posts about responsible teen driver safety. They're aimed at teenagers and parents of teens as well. Next slide. So each year there is the National Teen Driver Safety Week. For that week, every year, we always create some Facebook posts that we ask our communications team to post on our health department website. Most of the posts we adapt from NHTSA, which is the National Highway Traffic Safety Administration, or the CDC. They do have a lot of information about teen driver safety, but the rules that we always emphasize are no cell phones while driving, no speeding, no drowsy driving, no passengers, no alcohol, and always buckle up. The 6 rules for the road according to NHTSA. Next slide. So these are some of the other graphics that NHTSA has come up with some certain statistics, things that kind of hopefully are getting people's attentions and reminding parents that they need to talk with their teens, having that conversation with them and a continuing conversation with them about responsible teen driving behaviors. Next slide. And so NHTSA also came up with some posts that are aimed and graphics that are aimed more at teenagers. They're a little bit shorter. They're to the point. The graphics are hopefully a little bit more appealing to teenagers. So take it slow, everyone buckles up, stay off the phone, no alcohol or drugs, and fewer passengers is better. Short and to the point, so that hopefully appeals to teenagers that they'll be more likely to follow those. Next slide. And as you can see on here as well, you can also see some of the other graphics on here. So again, maybe being an influencer, teens, maybe they follow TikTok videos, they follow people on Instagram, things like that. So there's talk about being a good influencer to your friends as well. Next slide. So one of the high schools, when I do presentations with them, also especially if I do it with a group out of particular high school, I do kind of encourage them to also what would appeal to you since you're teenagers, what would appeal to your peers, to encourage them to be safe and responsible teen drivers. One school, Marana High School, they came up with doing safety grams during Valentine's Day week. Instead of giving them like a Valentine's Day gram, they printed a bunch of memes that have to do with safe driving, whether texting and driving or wearing your seatbelt. And they gave them out for free in their cafeteria on Valentine's Day. So, what says, it says, you care about someone by giving them a safety gram. So that was one of the creative things that one of the high schools did. Next slide, please. So what you can do if you're, whether it's a high school or a school district, we do usually do two big social media campaigns. One is National Teen Driver Safety Week. This year it'll be October 19th to the 25th. And then we also do a Pima County Teen Driver Safety Week. It's usually in late April, early May. We time it to coincide with prom season and graduation season. So it reminds teenagers that we want you to have fun, but please do it in a safe, responsible way as well, especially when you are driving or if you will be driving. So if we will work with communications team to again do those posts for those 2 weeks, but hopefully we can send it out to our school health updates team as well, and they maybe can share it with you. And then if you could work with your communications team to post it maybe on your Facebook page for high school or maybe to Facebook for your particular school district, that would really help us promote our messaging as well. Next slide, please. And so this is a short video here. It's just, I think it's only about 45 seconds. It's a commercial reminding parents, make sure you have that conversation with your teens about safe and responsible teen driving behaviors. It's entitled Whoa. After you watch this video a couple seconds in, you'll get real quick why it's titled that way. Okay. So next slide. So as you can see from that video, it did remind parents, just a few simple rules, have that conversation, also have continuing conversations, not just a one-time conversation, but every so often check in with your teens, make sure that, that they know the safe and responsible driving practices. So my contact information is there. My name is Sam Cha with the Maternal Child Health Program or Responsible Teen Drivers, and our MCH program, that's our email address as well. It will go to our team as well. So thank you again for your time, and thank you for listening.
Thank you so much, Sam, for that wonderful presentation. Again, there's chat box open. If anybody wants to put any questions for Sam, please put them there. So I do see a question from Michael. Looks like a thumbs up. And I do have our next presenter, final presenter for today, Ms. Ana Guerrero from the Teen Pregnancy Prevention Program. It's all yours, Ana.
Good afternoon, everybody, and welcome for joining us. Go ahead and go to the next slide. So our program that I am a program coordinator for is our teen pregnancy prevention program. And with our teen pregnancy prevention program, we provide an abstinence plus curriculum for ages 12 to 18 using the curriculum Making Proud Choices. That curriculum is an 8-module curriculum, and each module is an hour long. We do provide adulthood preparation subject PowerPoint, which is based on adolescent development. We do talk about physical changes that occur during adolescence, as well as cognitive growth. And then we touch on gender identity and the importance of pronouns. Next slide. So Making Proud Choices curriculum gives the youth the tools, knowledge, attitudes, and skills to reduce the risk of unintended pregnancies, STDs, and HIV. It also is an evidence-based curriculum that uses discussions, DVDs, games, and a condom demonstration, as well as role plays. Next one. So the program is designed to help youth get the correct and reliable information that is needed to reduce their risk on diseases, develop attitudes that support safer decision making, as well as build skills to provide the abstinence for and from sex, as well as to use latex condoms if they choose to have sex. We also want them to build confidence in the ability to obtain from sex or practice safer sex methods. Next slide. The program helped, oh, sorry. And with this program, we do ask, which was not put in the slide, is that anyone that is under the age of 18 does need to have a parental consent, just so for, letting us know that they are welcome into the program. Again, our program is the Teen Pregnancy Prevention Program, and we are here to empower our youth. And my contact is listed on the slide, as well as my program manager, Jessica Dalton, if you guys have any questions. Thank you again.
Thank you so much, Anna, for that presentation. That's going to conclude our school health update for this March. I want to thank everybody for joining us. I will stay here on the call here if you want to put any questions in the chat or have any more questions for us or any of the presenters that are presented today. I want to let everybody know you can visit us at www.pima.gov/healthy-schools. We're able to be reached at 520-724-7018, and our email to reach us is schoolsupport@pima.gov. Again, thank you for joining us today. I'll stay on for a little bit, and if you guys wanted to head out early, you may do so and enjoy your Wednesday. Wanted to also let you know one last thing. Our next school health update is going to be April 2nd. That's going to be the first Wednesday of the month.